Welcome, and thank you for standing by. At this time, all participants will be on a listen-only mode until the question-and-answer session of today's call. At that time, you can press star 1 to ask a question from the phone lines. I'd also like to inform the parties that today's call is being recorded. If you have any objections, you may disconnect at this time. I'd now like to turn the call over to Ms. Danielle Nelson. Thank you, and you may begin.
Hi. Welcome, everyone. Thank you so much for being on today's webinar. I just want to quickly say hello and welcome and let you know that our main goal of today's webinar is really to hear from you, the Aging Services Network. We do have some important news to share with you regarding Older Americans Act Title IIID. And after we deliver the message, we want to open up the phone lines as well as the chat function of WebEx to hear from you. So without further ado, I'm going to pass things over to our first speaker in today's webinar, who is Greg Case. Greg?
Thank you, Danielle. Good afternoon and welcome to this webinar on Older Americans Act Title IIID, Disease Prevention and Health Promotion Services. Title IIID of the Older Americans Act was established in 1987. It provides grants to states and territories based on their share of the population aged 60 and over for evidence-based health promotion programs which reduce the need for more costly medical intervention. Priority is given to serving elders living in medically underserved areas of the state or who are of greatest economic need. While the Aging Network has been moving towards evidence-based disease prevention and health promotion programs for the past several years, the FY 2012 congressional appropriations now require that 3D funding be used only for programs and activities which have been demonstrated to be evidence-based. AOA developed a graduated or tiered set of criteria for defining evidence-based interventions implemented through the Older Americans Act. The definition was developed based off of HHS sister agencies' evidence-based definitions. However, we included a minimal and intermediate criteria in order to allow the network to catch up to the new requirement. All states are encouraged to have a phase-out date for when their 3D funding will meet only highest-level criteria. Communities should check with their state unit on aging for the current state-specific Title IIID requirements. There is a Title IIID highest tier criteria evidence-based disease prevention and health promotion programs cost chart on the AOA 3D webpage. It includes 43 different programs. It is not an exhaustive list of interventions. Program submission was a voluntary self-nominating process in which intervention developers elected to participate. Programs do not need to be listed on this webpage to be an appropriate use of OAA Title IIID funds. However, interventions must be evidence-based as outlined in the EB criteria. The evidence-based definition should be used as a checklist to determine if a program is evidence-based. Each of the 8 bullets need to be checked off in order for a program to be considered a highest-level criteria evidence-based program. AOA is no longer taking evidence-based program submissions for the 3D webpage or cost chart. ACL now has a new process for reviewing evidence-based programs. Visit the ACL Aging and Disability Evidence-Based Programs and Practices webpage to see the new process and list of 8 programs which have gone through the new review process to date. The 8 programs are also 8 of the 43 included on the 3D highest level cost chart. All programs must meet highest level criteria to be considered an aging and disability evidence-based program. In just a moment, you'll hear more about the ADEP process from Bob Horniak. Unlike medication management set-aside requirements, once found in the appropriations language for Title IIID, it looks like the evidence-based requirements is here to stay. The reason being, it is included in the OAA reauthorization markups, which have made it through the Senate Reauthorization Committee. The screen captures you see here include the markup of the OAA reauthorization, which includes the evidence-based requirement inserted. The takeaway from this slide is the evidence-based requirement that became law through the 2012 congressional appropriations, the law that Congress passes to give us Older Americans Act funding, looks like it's here to stay thanks to future OAA reauthorization. It's important we move toward and continue implementing Congress's ask that all 3D funding be used for programs and activities which have been demonstrated through rigorous evaluation to be evidence-based and effective. Several states now require highest-level evidence-based programs for OAA Title IIID funding. We applaud these states. A few other states report moving in this direction, indicating they plan to use a phase-out date and or increasing percentage requirement to get to the 100% highest level. We encourage states who have upcoming state plans to consider doing the same and communicating your 3D intentions through the state plan process. Several states have also created internal processes for reviewing and approving evidence programs. The Florida Department of Elder Affairs encourages highest level criteria. They created a tool to help in approving evidence-based programs and determining which tier the services fall under. In Florida, AAAs must inform the state prior to delivering a new evidence-based program not listed in their contract or in the service description handbook. The AAA is then required to submit all the necessary information to the department so that they can make a decision about whether or not the activity is an evidence-based program meeting the current AOA three-tiered criteria. Now I'd like to pass things along to our next speaker. We asked Ms. Laura Trejo to be on today's webinar to share how her AAA has moved to highest level criteria. From the city of Los Angeles, please welcome Mrs. Laura Trejo.
Thank you. I'm really excited to be as part of this webinar. Los Angeles has been on a long course for implementing evidence-based health promotion programming in our communities. And I prepared a deck of slides. I'm not going to go through it, so I encourage the listeners to please view it after the presentation. Los Angeles has a very large population. Our needs assessments repeatedly tell us that we have a lot of seniors with disabilities who are reporting a great deal of need in terms of having viable opportunities for improving and controlling their health. We also have had a long history of working in this area with our colleagues at the Administration on Aging and ACL and at the local level with our partners. I want to encourage all area agencies to really look at this as a great opportunity to reach out to academic institutions, health systems, and others, as we have done to leverage these resources. If we can go to the next slide, please. The next one. I've also shared with you some of our sort of the way that we've embedded it. We've actually created what we call the Los Angeles Wellness Centers Network, which means all of our senior centers participate as part of delivering these services in the community. But we've directed the 3D funds, including other resources we've been able to match. Actually, the federal language gave us some of that opportunity to really encourage that we could match other funds locally. We've also utilized the language to develop, I think, very unique partnerships like the one we have with the LA Unified School District, which right now is probably worth about $3 million to us. We've trained hundreds of leaders in the community by engaging local community colleges and others to work with us. So we're very, really pleased with how our small allocation has really blossomed into giving us lots of opportunities. I've also included as part of my deck some other examples of work that we've been doing locally to sort of expand and really engage our providers in innovation and creating new opportunities for creating wellness in the community. If we can go to the next slide very quickly, I will just mention I gave you a sense of our process. As you can see, over time, we actually contract for completers, not for participants. So that's highly encouraged our network to really look at making sure that people are staying through the process of these workshops. We currently have about a 60 to 80% retention rate, which we're very proud of. As you can see, we have a small array of choices that we issue through our contracts that our agencies can use, and we also have a process for them to nominate programs that they would want to do at the local level. Next slide, please. This is just some photos for you to see our seniors enjoying themselves and getting healthier. Next one. This is our Active Start. This was actually an Administration on Aging grant that we shared with Oasis Institute. We're very proud of. There's also an article if you want to learn more about our work in terms of implementing these programs at the local level. The next slide speaks to our Xer Gamers Wellness using technology, the Kinect Xbox and Microsoft's Health Vault, which is free of charge, available online to get seniors more engaged and really owning their health decisions. And the next slide is On the Move, which is an actual docu-series that we developed to highlight all of our evidence-based programs citywide and encourage seniors, kind of like the Biggest Loser model, so that they would engage in fun activities that make them healthier over time. That's on YouTube if you want to see them. I encourage you to think about how to utilize. We actually went to a public access television program, and they developed the shows for us. Next slide. This is just a list of all of our programs. As you can see, we actually have a part of our contract requirement is that we use the highest level programs already, and so most of ours are at level 3. Next. This is just another opportunity as part of our work. We keep looking to who has money and resources. We actually launched with our public health department our Alliance for Community Health and Aging, really to promote self-management education and evidence-based programs around our entire county. And so that is being extremely well received by the community. As you can see, we have over 80 partners already. I think that's what I wanted to share with you, is that we have found tremendous opportunity for reaching out to partners in the health environment and academic settings and in other allied areas that normally would not work with us. So for us, the 3D focus on evidence-based programs has been very, very fruitful, and we believe that we can have community-wide impact on population health. Thank you.
Wow, that was very quick and efficient. Thank you so much, Laura Trejo, for being with us today. And
thank you.
And I now want to turn things over to another Laura, this one being Laura Lawrence.
Mm-hmm. Yes, thanks, Danielle. And thank you, Laura, for everything you're doing in LA, your partnerships, the fact that you like our Title 3D highest level criteria. It's all very impressive and humbling as well. So thank you.
Well,
Plus,
thank you
and I like your name, too. Okay, so I imagine by now some of you listening to this webinar have already figured out why we called it Moving On Up. The future of Title 3D funding is that we're moving on up to only the highest level criteria. But we're not there yet, so stick with us. Let me digress a little bit here and talk a bit more about the past. I know that Greg talked about it a little bit, but it's important to understand so that we can pave the way for how we're going to move on up in the future. So as Greg told us earlier, the law changed mid-year in 2012, requiring Title 3D funds to be used only for evidence-based programs. So back in 2012, we consciously and purposefully developed this 3-tiered definition of evidence-based. You can see it on the screen right now. Minimal at the bottom, intermediate in the middle, highest level at the top. And there was a method to our madness. So even though the rules changed mid-year, because we designated 3 levels, we knew right from the start everybody would meet the law. So you didn't go to jail, we didn't go to jail, we all met the law, and life was good. Okay, so let's take a look at these 3 levels on the screen again. And this is indeed what is currently on our website. So you'll see there's a total of 8 bullets within the 3 tiers, and you're supposed to use them as a checklist. So you move from the bottom bullet in the bottom level. Okay, so see minimal criteria. That bottom bullet says ready for translation, implementation, et cetera, et cetera. So you move from there and you move up bullet by bullet. So let's see. Does the program I am paying for with Title 3D funds, is it ready for translation, implementation, et cetera? Check. Yes. Then I move up to the next bullet. Does it meet that one? Yes. And I keep moving up until I answer no, and then whatever level I'm in at the time, that's the level that program is in. So it seems pretty straightforward, right? In order to meet that highest level, you have to meet all 8 bullets from the bottom to the top. But if the program that you're spending Title 3D money on meets any of those levels, you still meet the federal law. So let me pause a moment for a disclaimer, just like Greg had the same disclaimer, just to remind you that, as always, you want to check with your state unit on aging to see if they have any state-specific requirements. Because as we heard earlier, some of the states already require only the highest level. They beat us to it, and we thank them. But that's the state level. Right now, I'm just talking about the federal requirements. Okay, so that's the end of my disclaimer. And actually, that's the end of the history of how we got to where we are today. So now let's talk about the future. So our goal is, and it's always been, that all Title IIID activities meet the highest level criteria. That's been our goal. So here's where it's time to pay attention. Drum roll, Danielle, can you give us some sound effects maybe? As I deliver this important news. Okay, so our goal, highest level only for all states, for all Title IIID program spending, will soon be a reality. So let's go to the slide that we're on right now, and you see these crossouts. Let's talk about that. At some point in the near future, the current 3-level definition that had those 8 bullets, we just saw it on the previous slide, that's going to give way to 1 evidence-based definition with 5 requirements. And today's webinar is the first time we're making this announcement. So let me say it another way. Our goal of highest level only is soon going to become a requirement. And when is soon? Okay, stick with us. We're going to get there. So take a look at the slide that's up there right now. So you see these crossouts. Once all 3 of those levels of bullets are collapsed into this 1 definition, it becomes obvious that many of the requirements are actually kind of redundant. Okay, so and we're going to 1 definition, so we don't want redundancy. And so the 3 bullets you see crossed out are going to be dropped from the definition when we go to just 1 definition. So no longer will there be 8 bullets and criteria, only 5, all in the same level, which is highest level. So when is soon? This slide says future. And I hope you're still with me. You can't see me, but I'm doing aerobics right now to keep up the momentum because this is exciting news. And I can't see you, so you continue doing whatever it is you're doing. But stick with us because we have some more important information. This is the future. Those 5 bullets are the future Older Americans Act Title IIID evidence-based definition. So it's just like the previous slide, but we cleaned it up a bit and we removed the crossouts and we reordered the bullets a little bit just so they flow better. But this future definition has the same criteria as our current Title IIID highest level criteria definition. So if you're using Title IIID funds for a program that meets the highest level criteria today or tomorrow, it's also going to meet this future definition. Same. Okay, the $64,000 question. When will this change from goal to requirement take place? And the answer is not until after we hear from you. Okay, we're not going to shove a date down your throat. Don't worry about that. We need to hear from you. So in a few minutes, after we hear from Bob Horniak, we're going to be asking for your input in 2 areas. Okay, the first one, tell us what you think is a reasonable date to require all 3D funded programs to meet only this highest level criteria. And 2, tell us what support and technical assistance, if any, you need from us so you can meet that date. We're not going to change the Title IIID webpage with that current 3-level, minimal, intermediate, highest definition until after we hear from you, the Aging Services Network. So for the next 45 days, what's that? Let's see, July 19th. Okay, I think that's a weekend. Why don't we say the end of July? Okay, through the end of July, we invite you to provide us your feedback on those two specific questions. What's a reasonable date, and what support do you need? And we ask that that feedback goes through your regional liaison. We're going to show you that in a minute. We're going to consider all of the feedback you send us through the regional liaisons through the end of July. That's our promise to you. Then in August, we're going to let you know the official date for moving on up, for being on up to that highest level only. So take a look. These are the regional contacts. My guess is you already know who your ACL contact is in your region, but if not, this slide is a good reference. Obviously, you don't have to sit here and, find out. I'm not even sure what order these are in, but, find out your state and look. This webinar is going to be posted, and chances are you already know your contact. So we're going to get to hear your feedback today during this webinar, but obviously we're not going to be able to let hundreds of you speak because we only have an hour today. So don't feel bad if you don't get a chance to talk on this webinar. Please do still send us your feedback on a realistic date and what support you need through your regional contact. We're also asking, we only have a certain number of people on the webinar right now. That isn't everybody in the Aging Services Network. So spread the word to others who couldn't be on the webinar today. You know them. You know they might have some input. We want to hear from them too. So that's your takeaway from this webinar. Send your feedback to your regional liaison. But one caveat, we're asking what support do you need? Don't tell us you need more money. We know you need more money. As my husband would say, we all need more money. We don't have more money. That's not what we're talking about. We're talking about what other support, do you need help with what programs are highest level? Do you need help on, figuring out what's highest level? What technical assistance do you need for moving on up? And then as we hear from you, Danielle's going to be busy because she's going to be refreshing the FAQs on our Title IIID webpage with the questions that we receive from you through the regional liaisons. Okay, so here's a bonus. For those of you who were on hold, and I'm hoping this was still true because I was on the presenter's hold, so I didn't hear music. But if you were on hold listening to the music as you waited for this webinar to begin, when you give us the date and what TA you need, let us know the name of the song that you heard, the artist, and the year it was released. And here's a hint. It's relevant to this webinar. Okay, so that's the mystery there. So, as promised, we're going to consider all your feedback. That will help us determine the date for highest level criteria only. And then, as Danielle said, by the end of next week, we'll be posting a copy of this webinar on the Title IIID webpage, inviting your comments on those two questions to your regional liaisons. So that's it from me, and I want to welcome now my colleague, Bob Horniak, who's going to share with us a few slides about a new ACL process that Greg had mentioned at the beginning, the ADEP process. But more importantly, he's going to share with us why evidence-based programs are so important to the population that all of us so passionately serve. So, Bob, I'm turning it over to you.
Thank you, Laura, and good afternoon to everyone. Really glad to be here, and thanks to Danielle for this invitation to share some of this information with everyone. One of the things I wanted to do is to make sure that we always put these programs into context. And because the office that I work in, the Office of Performance and Evaluation, really looks at the data that your agencies, state units, area agencies provide to us. So the first thing we have to really understand in terms of who we serve, to understand the programs that affect them, we look at that the aging network comes in contact with nearly 1 in 5 older adults in this country every year. You can see from the U.S. population, almost 56 million people in this country are age 60 and above, and our clientele, our consumers, number about 11 million per year. We certainly look at the contrast between the U.S. population in terms of poverty at 9.3% and our clientele who are 30% in poverty. An important indicator, though, is also the near poor. When we are looking by service, and that's why there's a range there. There's some differences between nutrition, case management, and other services. But somewhere between 73 and 85% of the participants in Older American Act programs are near poor. That means 150% of poverty or less. The next slide, please. So as we also look at other data, and you know these data in your local communities probably much better than we do, but at the federal level, the national level, we know a number of risk factors include people who live alone. And for the Older American Act participants, over half, almost to 7 out of 10, live alone. A high incidence of diabetes, and particularly in some subpopulations, some ethnic and minority populations, those issues around diabetes, heart conditions, other chronic conditions are very, very high. We also look at the incidence of people who live in rural areas who may not have as readily available access to these services as other populations. So I wanted to just put that in context. The last context that we'll have is, well, we're looking at people who are at risk of emergency room visits or hospitalizations. It's incredible to think that over 90% of the people that we provide services to and on their behalf have multiple chronic conditions. That's 2 or more chronic conditions, compared to just about 73% of the older adult population. 69% of our case management clients take 5 or more medications. And one other data point, 14% of our transportation participants take 10 or more medications per day. One of those things I'd ask you to remember in terms of those medications, because we're going to come back to that. So next slide, please. And Greg and Laura both mentioned this ADEP process, Aging and Disability Evidence-Based Programs and Practices. Early on, a few years ago, we began to look at what does it mean to be evidence-based. And there was some pushback from some of the principal investigators in terms of our ability to really say what is an evidence-based program. So imitation being the sincerest form of flattery, we worked with our friends at SAMHSA who have a similar type program, and we worked with them and their contractor to really develop this ADAP process and look at the similarities between this process and what Lawrence was just going over for all of us. To be part of this ADAP process, the interventions selected have to be through either a randomized controlled trial or quasi-experimental design basis and be published in a peer-reviewed journal. To do that, to understand what that means on a number of scoring criteria, what we look at is involving 2 panels of independent expert reviewers. One set of these reviewers look at the ratings of quality of research, and we have experts in research methodology who look at that to make sure that that is the highest level of research and accounting for all the different dynamics that occur in research. But then other reviewers rate those programs on the readiness for dissemination. It's one thing to be published in a peer-reviewed journal, but if there are not materials, guides, slides, videos, user manuals, supervisor manuals that really allow local community organizations or states to implement those, then it's really not ready for dissemination. The final review summaries provide reviews, numerical scoring, but also talk about the cost of those interventions, since some of these are proprietary, and the translational work that goes on. Please note, as is indicated in the italics, that because a program is reviewed, even very favorably reviewed, we do not say that that's an endorsement of that program by ACL. We are saying that it has been rigorously reviewed, as the law says for Title IIID, and evaluated at that level. I would also like to mention that Alice Lynn Reisman is the project officer for the ADAPT project. Next slide, please. So here are a few examples of some of the things that are on the ADAPT site. And as Laura Trejo from Los Angeles indicated, one of these home meds, I think, is offered in Los Angeles. But if you remember the number of medications that some of our participants take, I think it's critically important that things like home meds and other review programs really take a look at that. So we can just look at some of these. There are others. We're planning to expand that list. We are doing that in a very thoughtful way because we can only review so many per year, but we will be expanding that. One additional note that I would make, we work closely with CMS. They have done a retrospective study of evidence-based programs. They are now engaged in a prospective study of evidence-based programs. We will be sharing the results of that study because we also believe some of those will be very, very important for all of us to know about and will be very ripe for other dissemination. So with that, I'm going to turn it back to Danielle Nelson.
Hello, everyone, and thank you for staying with us. We have come to the end of the presentation portion of the webinar, and now we want to invite you to submit your questions both through the chat function WebEx. Some of you have already done so, and thank you. But operator, we'd like to open up the phone lines and receive feedback and questions. So if you could please, Latoya, give instructions on how participants can do that.
We will now begin the question and comment session. If you would like to comment or question from the phone line, please press star 1. You will be prompted to unmute your phone and record your name. Your name is required to introduce your question. Again, it is star 1 to ask a comment or question. One moment, please.
And while we wait for our first caller, we just wanted to remind everyone on the screen right now is your regional point of contact. And for the next 45 days, but just for simplicity's sake, let's just say the end of July 2014, we invite you to provide feedback to your regional liaison who's listed on this webpage here. And the webinar will be archived on the Title IIID webpage. It'll be posted by the end of next week. And you will also receive an email next week thanking you for registering for this webinar and letting you know that the webinar has been posted. And while we wait for the first question to the phone line, we have a question that's come in through the chat function asking if Tai Chi will be considered for the ADEP process.
Tai Chi is one of those ones listed. So, yes, that was definitely one of those. And it's also one of the ones in the retrospective study done by CMS that really showed total Medicare savings as implemented, but we're still looking forward to the prospective study to further document that.
Excellent. Thank you. And Latoya, do we have our first question or comment?
We have one comment from Kathy Metapearl. Your line is now open.
Hi. I work in the Region 2 office, and I just want to make a comment about the slide for the feedback and the questions. For the top 6 employees, the Regions 1, 2, and 3, all the phone numbers seem to be incorrect, but the email addresses are all correct. So I just wanted to bring that up to everyone's attention.
Thank you. We'll correct that before it's posted on the Title IIID webpage.
Thank you.
And Latoya, do we have another question?
I'm showing no further questions from the phone line.
All right. And we now will go to the chat function. We've gotten a few in. So the next one we have is, will music and memory programs be considered evidence-based? And to answer that question, really you have to look at the definition, and so that goes for the current definition as well as the future because they will be one and the same. So if a program currently, as of right now, can meet these criteria as you see on the screen, and really this needs to be used as a checklist. So you're moving from the bottom, the minimal criteria, and working upward, checking off each of the 8 bullets. So currently today, if you can go to a program and check off this list for each of the 8 bullets, then yes, it's considered evidence-based at the highest level criteria. If you can say that today, when the definition changes to the future, which is the same definition as the highest level, just cleaned up, because as you can see, there was quite a bit of redundancy when the 3 tiers are collapsed into one, then you can say, yes, that program is then considered evidence-based. And we have another question that's come in through chat, and it says, can you tell me if powerful tools for caregivers will continue to be a highest level program? excellent question. Any program that's currently listed on the Title IIID evidence-based cost chart, you see it at the bottom of the screen here, and you also see it on the current 3D webpage. Those programs will remain highest level criteria programs, so in essence meeting our future definition. So those 43 programs will remain posted on the 3D webpage through this URL link to the cost chart. And so yes, those programs listed will continue to be evidence-based. LaToya, do we have another question on the phone line, or should I continue with the chat function?
I'm showing no further questions on the phone line.
Okay, then I'll go to the next chat question, which is, okay, I was wondering if the English version of chronic disease self-management, why it's not listed, but the Spanish version is. And I'm guessing that you mean for the ADEP process. And so, Bob, would you like to take that one?
Well, yes, because one of the things that we realized, and we worked with Dr. Kate Lorig out of Stanford University, and actually that was one of her recommendations because of the high incidence rate of diabetes in the Hispanic Latino population. She thought that that would be a priority to have that listed and reviewed by the ADEP process prior to any of the other programs. And there are multiple programs that Stanford University has that are evidence-based for chronic disease and others, but that was one of the recommendations, so that's why we put that up there, and we'll be looking forward to additional work with Dr. Lorig.
Excellent. And I'm going to go to the next question that's coming through the chat function. It's regarding Tai Chi as well. And the question is, only one form of Tai Chi is currently listed on the ADEP reviews. Will other programs of Tai Chi be included? For example, the Arthritis Foundation's Tai Chi program for arthritis.
There are multiple designs on many of these programs, and what we are looking at is certainly we can either go breadth or depth into some of these. And at this point, because of the where we are with these programs, we've decided to try to go breadth that is wider than deeper, and there are multiple forms of some of these, so we would like to have as many of these available as possible, and as we go further into these reviews, we will look at doing multiple reviews of a similar program, perhaps for different populations, but we would like to get as many diverse programs up there as possible.
And just to build on that question, any program, the program doesn't have to be on our webpage to be an appropriate use of Title IIID funds. And because we are no longer taking new programs to be listed on the Title IIID cost chart, we stopped taking programs for review last summer. And so now, if there are 43 programs, as you see on this cost chart, that are listed, and the 8 programs on the ADEP page are also listed as 8 of the 43 on this cost chart. If you would like to use a program not listed, that is fine. You don't have to use a program on the web page. However, the program must be evidence-based, meeting the criteria seen on the 3D web page and on your chart today. And as we noted earlier in the webinar, some states are already requiring highest level criteria programs, and some states are also reviewing programs internally, like we mentioned that is going on in some states, including Florida. So some states already have internal processes developed to review within the state. And so I would refer to your state unit on aging with your question on specific programs. LaToya, do we have a question through the chat function? Through the phone line?
Showing no questions on the phone line.
Okay, then we will continue on with the chat. Our next question is, are Title IIID funds still restricted to only age 60 and over, or can they be used for persons age 18 and over with a disability? And to answer that question, because it's specifically stated within the Older Americans Act, the answer is yes, they must still be used for persons age 60 and older, and that's a regulation specific to the Older Americans Act. And so I will keep going then on the chat function. We have a question regarding exercise classes. And the question is, how can I move a program to highest level? And so really the answer to that is the program has to meet the evidence-based criteria, and it would really depend on the program at hand and where it is. So we couldn't give guidance without knowing about the program. And so please use your regional contact to find out more to further answer that question. LaToya, any questions through the phone?
No questions on the phone line.
Okay, then I will keep on going here with chat. The next question is, will health screenings by professionals and medication management checks by pharmacists still be able to be reimbursed by Title IIID funds? And so to answer that question, no. Unless the answer is if you're meeting this evidence-based criteria, yes, but you would have to have, for example, are the research results for your program published in a peer-reviewed journal? So if you could check off each of these 5 bullets, then yes. But if it's a generic program that hasn't been reviewed and research findings published, the answer would be no. So it would really be dependent on the program in which you're implementing. And so again, I really recommend contacting your regional representative and sharing more information about the program you're implementing. So let's see, the next question. So great question that's come in. What is experimental or quasi-experimental design? And we had a lot of questions about that. So we added to the Title IIID webpage, as you can see at the bottom, let me move here to this is a screen capture of the current 3D webpage. And you can see at the bottom in very, very fine print, it says experimental design uses a random assignment control group. And then it goes on to explain what a quasi-experimental design is. And then URL link, this is on the 3D webpage. If you just go to the 3D webpage that I've included the URL link for here in the chat function, you will find this and you can click on the definition and get more information about what an experimental design is and what a quasi-experimental design are. Both of those, again, are included on the 3D webpage. LaToya, I want to give an opportunity, again, are the phone lines, has anyone called in?
To ask a question from the phone lines or to comment, please press star 1. You will be prompted to unmute your phone and record your name. Again, that is star 1.
Great. And I have another question that's come in through chat, and the question is, can you review the difference between the 43 programs that are listed on the cost chart and the 8 programs listed under the ADEP process? And to answer that, the 43 programs that are listed on the 3D webpage, which you see the URL link on your screen, those programs were program administrators that submitted their program to us at AOA from 2012 to 2014. And so that was independently their choice to submit the program. We reviewed those programs here at AOA through a review committee process. And the programs that were found to meet our criteria for defining evidence-based at the highest level were then put into this cost chart. And so we stopped taking programs. It was we were getting a lot of program submissions, so we decided to halt there. We've got 43 listed. And so now we have a new process that Bob Horniak explained, which for short is ADEP. You can see the URL list here. And so that has become the new ACL AOA review process. And so those 43 programs listed on the AOA 3D cost chart were reviewed when the evidence-based requirement was put into place. And now we have a new process similar to SAMHSA, the Substance Abuse Mental Health Services Administration's National Registry of Evidence-Based Programs and Practices process. And those 8 programs have already gone through the process. More programs will continue to go through the process, this new process. And to clarify, the 8 programs on the ADEP webpage are 8 of the 43 programs listed on the 3D cost chart. I hope that was clear. It was a lot of acronyms. And LaToya, just interrupt me if you get a call.
We do have a question from the line.
I'm excited to hear it. Please, let's hear.
Raymond Beveridge, your line is now open.
Good afternoon.
Hello.
This is Raymond Beveridge. I'm chair of the Prince William Commission on Aging, which advises the Prince William Area Agency on Aging in Prince William County, Virginia. Is there any plans as we move forward with this new criteria to integrate this evidence-based Title III with the CMS Strategy 2013 and beyond, particularly in Goal 3, where the senior centers are referenced as part of embedding best practices for managing care transitions from the hospital to home, and also in terms of Goal 4 for management of chronic disease self-management programs. End of question.
Okay, so I'm going to take a stab, and correct me if I'm not answering what you're asking. So you're wondering if 3D funds can be used for what your work is going on around your CMS work, and that would be care transitions as well as your chronic disease self-management programs. Is that the question?
No, actually the question is the Administration on Aging, as you look at the funding for this, here, if we write goals to match the CMS Strategy 2013 and beyond, keeping in mind as we drive more for participation in fee-for-service and these quality improvement organizations where aging networks' involvement with them brings us dollars, can we are you planning to tie the Title IIID program to where it blends in with the CMS strategy?
Well, that's certainly...
Or should I just write this to my regional coordinator so it can be figured out then?
That's not a bad idea. That's not something that we've currently looked at or discussed with CMS at this time.
But it's definitely worth considering. So your suggestion to email that to regional liaison is an excellent one, and we will follow up. Like all comments we receive, we will follow up with you on it.
Then Carmen should enjoy this greatly. Thank you.
And then Carmen and I will follow up with you. No, thank you for the question.
Thank you.
Latoya, do you have another one?
No further questions.
So I have another question here. It says, please clarify reference to the findings of CMS related to Tai Chi. Is it specific for programs listed under ADEP or for older adults participating in any Tai Chi class offered in the community as opposed to a specific program?
The question is the CMS review of Tai Chi.
Mm-hmm.
I believe that was fairly specific to Tai Chi. Again, they went through an environmental scan of over 200 evidence-based programs. That was narrowed down to 94 that have more evidence behind them, and then the final 12. We will send you the link to CMS did a report to Congress on their review of those programs, so we can make that link available. Danielle, we can make sure you get that, and that can be given to all the regional representatives and maybe posted on this site as well, so that everyone can see the exact way that was studied, evaluated, and that way I think it would most specifically answer that question.
Excellent. We will include that with the webinar link when it's posted, so that will all be posted on the same section of the 3D webpage. And I want to address another question that's come up. It says, our state has been moving on up, and we believe it's worthy to support Title IIID Level 3 programs. But right now, we are only at Level 2. As a result, we'd like to vote for a longer mandate to make it Title III programs. So I just want to say thank you for including that. If you could please specify when you follow up with your regional liaison what you mean by longer. We're looking for more specific feedback, as in when could you start requiring that of your AAAs to be at Level 3. So thank you for that chat post, but please be more specific, whether that's back in the chat function or with your regional liaison. And I will move now to the next chat function question. And we do have about 7 minutes, so can you please explain if oral health provided by a licensed dental professional will continue to be evidence-based? And I have to be honest, oral health is so near and dear to my heart that it saddens me to have to say, likely not. I will say that there are some programs in the works being developed for oral health that are evidence-based. For example, Oral Health America is coming up with an evidence-based educational program. And so it will be out next year, and they plan that it will meet our highest level criteria. But I am not aware at this moment of any evidence-based oral health programs that currently meet our highest level criteria. So I'm very sad to say I believe the answer to that is no. But if you find a program, please, please, please share it with us. We would be extremely happy to hear about it. The next question has come. Is there a date that all states must have level 3 in place at 100%? Great question. The answer to that is we are going to let you know when that date is in August, early August. All of the state units on aging and area agencies on aging will receive a formal email letting you know that when the date will be. But until that, we are accepting feedback from you until the end of July 2014 about when you can meet this criteria. We're not going to impose a date that's unrealistic. So we want to hear from you. When can you get there? So please, we ask you to continue to send that information. Let me switch to the slide here that includes all of your regional liaisons. This is how we would like you to submit your feedback. Please continue to submit through the chat function. We're going to keep this information. But email and or call your regional contact and submit to them feedback of when you can get there. When can your state, when can your AAA be at highest level? LaToya, do you have any other phones?
I'm showing no questions from the phone line.
All right, I think we have time for a few more here from chat. The question is, do evidence-based strategies fit into Title IIID at all? The CDC uses strategies to describe more general approaches to improving health that are not prescribed programs. So, to be honest, as long as that strategy is meeting the evidence-based criteria, it would qualify for 3D. But to be honest, I'm not exactly sure what strategies you're specifically speaking of. But again, I would love to hear more about it. We invite you to share that information. It sounds like something that we could look into further. And then I'm trying to scroll through the chat functions and get between the comments and the questions to be shared. We have a question about yoga. Will yoga programs be considered evidence-based? To answer that, as long as the yoga program is meeting the evidence-based definition, I'm going to go back to that. So looking at the current criteria, if a yoga program is able to check off each of these bullets at the highest level, then yes, it will meet our future evidence-based definition. So for example, the program is published in a peer-reviewed journal, it's been proven effective with older adult population, etc. So to answer your question, if it meets this criteria, these bullets can each be checked off, then yes, the yoga would meet the evidence-based definition. All right, we have one more question that's come in regarding cost sharing for Title IIID. The question is, cost sharing allowed for Title IIID? And Greg, do you want to answer that?
Cost sharing is permitted for 3D programs if the state chooses to do so and then follows all the other requirements of the provision. For example, sliding fee scale, self-declaration of income, no cost sharing for folks below poverty level, etc.
Excellent. Thank you. We have another question that's come in. Are care transitions programs considered evidence-based? And to answer that, the answer is yes. We have another question here. It says, is it possible for an agency to develop its own evidence-based program? I understand it would have to go through rigorous evaluation, but are we required to use only approved programs like Better Choices, Better Health? And the answer to that is we do not discriminate against evidence-based programs. As long as they meet the criteria you see on the screen here, then they are considered evidence-based in terms of our definition. However, we do encourage everyone to contact their state unit on aging because some states do have requirements, state-specific requirements, for their Title IIID funding. But great question. Thank you. We have another question here. In response to Tai Chi, it is generally a highest level program, even though it's outside of the ADEP program. So I just want to thank you for who submitted that. And really, we recommend if you have any questions about the Tai Chi program that you're considering, if it's not listed on either of the ADEP or the Title IIID webpage, please contact your state unit on aging to find out if it meets the criteria. And they can also contact the regional liaison to find out more. We're happy to work with you to ensure the programs are meeting the evidence-based criteria. And we are about at time. I want to just make sure, LaToya, do we have one last question in the phone lines?
Showing no questions on the phone line.
All right. With this last minute, I want to just remind everybody, please contact your ACL regional contacts to submit additional feedback. What we really want to know from you specifically is, when can you meet the new requirements? When can you realistically be at highest level criteria for your evidence-based programs? And what technical assistance is needed on our end to help you get there? So please give us that feedback. We look forward to hearing from you. We ask that you give us feedback by the end of July so we can let you know by early August when the change will become effective. And rest assured, it will not be this year. This is not something that's going to happen overnight. We know it's going to take time. But again, we invite and encourage you to please give us the feedback about when you can get there realistically and reasonably. And at that, I'd like to ask either Laura, do you have any last words before we close out?
Well, I just want to thank everybody for their attention and for those great questions. I mean, this really is pretty exciting because obviously the higher evidence-based, we're doing something much better for our population. I did also want to know, did we get that one song in there? Did people hear that song?
We did not, Laura. WebEx would not allow us to play it. But
okay.
Can you share with everyone? Everyone's dying to know what the song was.
Yeah, I'm sure I sounded like an idiot when I said that. But what we were going to do, compliments of Sam Gabuzzi in the field, was play a Curtis Mayfield song called Moving Up, or Moving On Up. Anyway, it was just exactly like the name of our program from the 1970s, which many of us were not around then to be dancing to his song, but it's a wonderful song. So I encourage you to look it up on YouTube.
Excellent. With that, we thank you all for your time today, and we hope you have a wonderful rest of your week. Take care.
That concludes today's conference. Thank you for participating. You may disconnect at this time.